I want to talk for a moment about eloping in autistic children. Now, if you're not around anyone that is autistic, you probably aren't familiar with the term eloping, or you might think of it as like running off and getting married. It is something when we're talking about autism that can be really scary. Eloping is when a child or adult suddenly flees from a situation that they're in. They can be when they're getting out of the car. It can be switching classes at school. It can be at home and they just walk off or wander off. And it's scary because we want to keep them safe and we want to know where they are and we want to make sure that they don't get hurt or injured or anything along those lines. Eloping is often a functional behavior for children with autism. It's not them being naughty. It's not them trying to cause a lot of distress or to get their way. The most common thing when we're talking about eloping is escaping from demand or sensory overload or from situations that we don't feel comfortable in when our anxiety is high. It can also be getting to a place that we want to go or get away from a place that we don't want to do. In some cases, it will be something that gets a lot of attention because it does get a lot of attention. It's not that they're trying to get attention in a negative way or just trying to get it. It's not that they're trying to get attention in a negative way. It's just something that gets a lot of attention. And there's some autonomic and automatic reinforcement that goes along with it. Running in and of itself feels good. And if we're trapped in school all day and we see the opportunity to run and we know that running feels good, we might just take off and run for a little bit. It can often happen when our executive planning system is not capable of taking a time for that pause, evaluate, choose that is necessary. And instead, we see the opportunity and we make a run for it without thinking a lot. Now, when it comes to what do we do to make sure they're safe? Well, there's a few things that we need to do to make sure they're safe. One, we should recognize times when they typically elope and figure out strategies for each of those. Now, common times when eloping happens is often with transitions. So getting out of the car, anxiety spikes, we see a path, we take the path. Switching classes at school, going out to recess, lots of different moments throughout the day, especially around transitions, is when you'll often see elopement. Part of that is, when possible, making sure that we have a safety plan in place that includes at home having high locks on the doors so that they can't open the doors and go without somebody that's tall opening it for them. At school, making sure they have somebody that is watching them, or a buddy, or a way that we're keeping it in check if we're prone to elopement. Other physical barriers like fences, door alarms, an ID alert bracelet, sometimes a GPS watch or something along those lines. Those can all help with elopement. And a lot of it then is planning in advance. When do we typically elope? And what can we do to protect the child? What can we do to lower the sensory demand, the sensory overload, the anxiety, so that they don't feel the need to elope? Because once we figure that out, the eloping starts to slow down. The other thing that really doesn't help is long lectures about the elopement that happened, because it just won't sink in. This autistic 6-year-old, neurotypical 6-year-old, doesn't realize the ramifications of their actions when it comes to hopping out of the car and running across the parking lot. Giving them a long lecture isn't going to make a big difference. You might use a social story to explain, here's what happened, here's why it was scary, next time what should we do? And you practice, especially when conditions aren't as high.